Hello, everyone. This is Dr. Amigues, your friendly rheumatologist and host of the Unabridged MD podcast. Today, we are joined by Dr. Mona Sodi, who is going to talk to us about body composition, which is a huge issue right now as the aging population, and is also something that that can be problematic in patients with inflammatory arthritis. So without further ado, Dr. Sodhi, thank you so much for being on the show. Can you tell us how you got into this field?
Yeah, thank you so much for having me on your podcast. So I got into obesity medicine because of my own personal struggles postpartum 3 times with my weight. So the first 2 times, it was fairly easy to follow a simple, straightforward, diet and exercise plan to get the baby weight off. However, with my third pregnancy, I found it challenging. And the same things that I tried before no longer worked. Around that time is when I discovered that obesity medicine was actually a board certified field. And so I became board certified in 2020 in obesity medicine because what fascinated me was that the same rules don't apply to everyone. Some people have just a naturally small frame and they're able to maintain it without a problem. However, other people are plagued with metabolic disease, right? They have obesity, which comes with inflammatory conditions, right? They have high cholesterol, they have diabetes, things like that. And so I just wanted to be that person, that physician in the community to help patients navigate that process, because a lot of times it just doesn't feel fair that some people have this great struggle with obesity. And they look at their peers and they say, how come nobody else feels the way I do? So that really resonated with me. And so I became educated to be able to help patients navigate obesity.
I love it. And, there's so much data right now that links obesity to psoriatic arthritis, psoriasis, probably rheumatoid arthritis as well, cancer, and so on. So I'm with you in this field. I think it's a very, very interesting field. Now, talking about body composition, since this is your expertise, can you tell us a little bit more? My patients have heard me say it's not about your weight, it's about the composition of your body. So to me, it is indeed very important. But can you explain a little bit what this means from a physician perspective in this field?
Yeah, absolutely. So body composition is really just what are we made of? We're made of some water, mostly water, right? Some minerals, and then we're made of muscle. And what I care about is skeletal muscle, right? That functional muscle that helps us go up and down the stairs, carry our groceries. And then we're also made of some fat. And there's different types of fat, but for today's purpose, really it's the visceral fat that I care about the most, which is the fat that can pack around your organs. And so when you examine your body composition, you're looking at how much muscle am I made of? How much fat am I made of? And so if the weight on the scale doesn't change, but the body composition does, right? And we can increase our muscle mass and decrease our fat mass, by default, we're decreasing inflammation because fat is inflammatory, right? And muscle helps prevent disease, and muscle helps us even from an immune standpoint. So the more muscle we have, the better. The less fat, particularly visceral fat, we have, the better. And so that's what I like to follow along someone's weight loss journey. Like I said, the weight on the scale, it matters, but not as much as the actual body composition, right? What are you made of? That is more important to me. And knowing that if you build some muscle, your weight may go up, and that's okay. That's still considered a win.
Yeah, I love that. Even if your weight goes up, it still can be a win.
Yeah.
And so how do you tell your patients to follow the body composition? Like, do you tell them, hey, get a scale for that? Or are you telling them to look at their, like, how do you follow this? Because I feel like the patients in 2025 are very data driven. They want to see data.
That's correct. So in my office, I have a body composition machine. It's an in-body machine. It's very intelligent, and it can give lots of data, even intracellular water and extracellular water, like way more data probably than we even need. But it will give you your basic everything from bread and butter BMI to percent body fat, to skeletal muscle mass, to visceral body fat. Now, you can get a little bit less sophisticated machines at home. I'm not affiliated with them, but InBody does have at-home scales you can buy. and for personal use. So for patients that I see completely remotely, I just say, hey, you can buy a body composition analyzer, but maybe if you have access to an obesity medicine doctor or a gym perhaps that has a body composition analyzer, use it like once a month to track your progress. We don't need to be doing this daily, and I don't recommend that at all. Maybe zooming out on a month-over-month basis so that along with just the weight on the scale, we have some more objective data to say which way we're going with our body composition.
Yeah, I really love this. And so there's always been this question, and I can't remember if it was in medical school for me or if I learned this later. I really don't remember, but about which comes first when you're trying to lose weight. And usually it's not like, when we're saying trying to lose weight, it's this quality, like let's change our lifestyle. And I remember someone saying, and I really cannot remember how we say which direction. Do we lose weight first or do we make muscle first? In my head, you do both at the same time. But I remember this super clearly that it wasn't as obvious as it seemed. What's your recommendation?
So so this is highly individual and it depends on someone's commitment. So to build muscle, I think for many people, it requires a little bit more intentionality. So you've got to be doubled down on things like protein intake and muscle growth, which involves stimulating your muscle so that you make micro tears and you grow it. You do that by lifting weights, heavy weights, right, for your body. And so for a lot of people, that's a commitment, dedicated time with their weights, dedicated protein planning. And so for that reason, for a lot of people, I'll just say focus on the fat loss. And then when you feel up to it, because for some people, when they just lose weight, any weight, they feel better, they can move their bodies better, they're more motivated to do things like strength training. And so for that reason, for most people, we focus on fat loss. And then when the muscle comes, it comes, and we can be very intentional. But if you wanted to right off the bat focus on muscle, that's totally acceptable. It's just that the weight on the scale may go up, right? And that's okay. And that can scare people. So I have to tell them, hey, this is totally normal. And, with the muscle building, then we can focus on fat. But for most of my patients, we do body fat loss first.
Got it. Okay, interesting. And I wonder, we've had many, because I'm so interested in this concept of inflammation causing arthritis or worsening arthritis or not allowing us to to treat and to get to full remission, inflammatory arthritis. It's been very interesting to learn about the different, options to get to a proper, a better weight and better body composition. But I wonder, just from your expertise, from who you are right now, and it's February 2025, what excites you the most in this field currently?
I think the fact that we are able to monitor body composition, and actually there is a lot of attention on muscle mass, because in my era, I call it like the Kate Moss era, where nothing wrong with Kate Moss, she's an excellent model, but the focus was just on being as skinny as possible. And I think that has been ingrained in so many of our minds, that was the standard of beauty, that was almost a social status. But now we understand that it's so much more than that. It's really how much muscle you're made of. And I think people are really getting that really resonates with them, that it's not just about weight loss and being as small as humanly possible, but it's actually about longevity and being there for your grandkids and living your longest, healthiest life. Your quality of life matters. So the fact that there's this huge emphasis on muscle mass now, I think is the most exciting thing for me.
That's really wonderful. And I don't think I've ever heard that. And I think that's very exciting. So, our podcast is about hope driven by science. So it's really important for my mission, for our mission at Monarch MD, that we offer hope. Can you share a story that would embody this phrase, hope driven by science? Like, do you have a patient story that you can tell us about this?
Hope driven by science.
Meaning,
yeah.
Yeah.
Yeah. Let me think on that. I think that, so I had this is a common scenario, but my patient that comes to mind is someone that put themselves last. They're a medical professional, and they gave it the training their all. And they're doing DoorDash, and they're doing, they're just making it day in and day out. They're in the operating room all day. They come home, they DoorDash. They're in the operating room the next day. It's like rinse and repeat every single day, until they literally collapsed in the OR out of exhaustion, went to the ER, found out they have type 2 diabetes, found out all these things. Thankfully, their heart was okay. And then they came to me, and I explained to them, that their weight was a barrier, and they felt intimidated by that barrier. And so we talked about the medications that are now available, that are evidence-based. So the glucagon-like receptor, like peptide agonists. And so the GLP medications are the science that gave them hope to say, I can do this. It's evidence-based. The GLPs were a safe way for this individual to lose weight, and they're diabetics, so their glycemic control was improved, and they are no longer collapsing. They are actually moving about day to day in a reasonable way. They feel normal again. They're not having DoorDash. I mean, it's amazing how life-changing these GLP medications can be for the right person, that felt defeated maybe, and felt like they were in a really bad place. Maybe they hit rock bottom with their weight and something catastrophic happened to them. And they just needed that push. They just needed something to kind of get them over that mental and maybe physical barrier of, getting to the other side of weight loss. And so I really think that the GLPs were the science-backed hope for them.
I love it. Thank you so much. Well, Dr. Sodi, that has been such an interesting conversation. Thank you so much. I wonder if you can tell us where we can find you, and when can our auditors learn more about what you have to offer, work with you, and learn more from you as well.
Yeah, absolutely. So I have a website, monarchconciergewellness.com, and then you can find me on Instagram at Dr. Mona Sodi. And I post there with educational content. So happy to have you there.
Yeah, and we'll put some show notes, and we'll put all of this in our show notes as well. Dr. Sodhi, it has been such a pleasure to have you. Thank you so much. And I'm sure we'll come back with a take 2 on, as the science of body composition is changing. Everyone, if you are looking for a rheumatologist, we are currently accepting new patients. So don't hesitate to jump on a discovery call with myself or Amanda. And you can do this at info@onabridgemd.com. And if you have here and you found this episode interesting, please share it with someone that you think will enjoy it. And put a comment, as this is how we grow our podcast. Have a wonderful day, everyone. Take care.
Bye-bye. Thank you.